Welcome back. It's time to get really practical. We're in our demo area and Dr. Herz is going to show us what do you do when you examine an eye.
Well, to make it so that everybody can understand what we're doing, I think it's helpful to go over the anatomy of the eye. The very front part of the eye being the cornea, and then the colored part of the eye is the iris with the pupil in the center, and then the lens being behind that. And so when I'm examining the eye, I examine those things with a high-powered microscope called a slit lamp. And then I also look inside the eye at the optic nerve and the retina and the blood vessels to check for any kind of eye disease. So the very first thing that I do in the eye exam is to check the visual acuity. And that is done usually with something that looks like this. And usually if somebody does wear glasses, I want to know how good their vision is with the best glasses prescription they can have. And so I would ask them usually to hold it up like this and to look at an eye chart either on the wall or a near vision card like this, and we would check each eye individually because it is important to know if both eyes are working properly.
Because they can be quite different sometimes.
Yes.
Right.
And then after we check the visual acuity, I may actually tweak the glasses prescription to determine if it needs to be strengthened or not. And then I move on and I'll check the...
Now, tell me, how do you check? I mean, we're looking at this eye, we know it's all enclosed. How do you see all these blood vessels in the retina at the back?
Well, so the first time that I saw them, I was really amazed that the pupil is really a window into the inside of the eye. So when it's dilated, and that's how I do a full eye exam, I'm able to, with the right magnification equipment, that slit lamp I was telling you about, and some handheld magnifiers, able to view the inside of the eye through the dilated pupil. And
to dilate it, to make the iris draw back, you put drops in the eye, right?
I do.
And that stays like that for several hours?
Yes, and we use the shortest acting ones, but usually it lasts for 2 to 4 hours. Right. Nobody really likes that part, but it's better than Novocaine. I always tell them that. I'm like, look, I'm still better than the dentist.
I didn't realize it was a competition, but there you go. But you're right.
So then, yeah, after they're dilated like that, which usually will take between 20 and 30 minutes, then I will be able to see all the structures inside the eye. And this is a portable slit lamp that allows me to be able to look at the front part of the eye in detail and determine if there's any cataracts or any abnormalities with the cornea. And then I would switch to a different handheld magnifier that would help me to view then the retina and the macula and the optic nerve inside the eye to check for things like glaucoma or macular degeneration.
So you can use an ophthalmoscope to do that.
That's true. So a direct ophthalmoscope is something that honestly ophthalmologists don't use as much because it doesn't give us quite as good of a view as our slit lamp does. But it is something that if you need something portable, that you would be able to look through a pupil with this and be able to view the optic nerve and the retina. And
us humble doctors who don't have slit lamps still use this.
Yes,
and with this, it can be quite scary because you have to go right up to someone, right?
You do, and the trick to it is you have to get them really to fixate in the same spot so their eye's not moving around and that you know what you're looking for.
Right, because if their eye's moving around, you're looking in here, then it's a bit like this.
Yes.
So it's really important to, when the doctor asks you to look in one spot, you just pretend you can still see that spot.
That's right, that's right. I appreciate it very much.
Now what's this little toy?
So this is one of the things I can use to check the eye pressure, which is something we do to screen for glaucoma. The slit lamp that I was talking about has a tonometer on it that is used to also check eye pressure. That's the most accurate way of doing it. But once again, if you're in a situation where either the person is not able to get into that machine or you're on the go, this is a way of checking eye pressure as well, and it just barely touches the surface of the eye, so you have to numb the eye up first to use it.
So you numb the eye and then you just put it gently against?
Just barely touches the surface of the cornea. And then it'll beep a couple of times and give you a reading, and then you can move to the next eye.
And that tells you the pressure inside here?
That's right. So the eye pressure is the inflation pressure of the eyeball, so that it measures how much pressure it takes to keep your eyeball inflated, so it's a ball and not a raisin. And that way people can understand that it's not blood pressure that I'm talking about, but literally just how much pressure it takes to keep the eyeball inflated. And if that pressure is too high, it can put pressure on the nerve tissue and cause it to die off over time, which is what glaucoma is.
And that's what we don't want. Well, thank you. That's enlightening. I like all your toys.
I do too.